Get ready and tune into the Doctor's Guide podcast, raw and unfiltered, a unique platform to help you optimize your health through dynamic role playing, real life challenges with expert guests and your host, Dr. Bart Rademaker. I'm Dr. Bart Rademaker, and this is the Doctor's Guide, raw and unfiltered, and really excited about sharing with you. We've already had one show before with the amazing Dawn and amazing Henrike, and that's the proper pronunciation in Dutch because I am Dutch. But I'm not used to saying speaking the Dutch language anymore, so it didn't come out quite right. But anyhow, let's get into this. What is this podcast really all about? Why is it that you want to listen? You want to listen because you're probably, I don't know you personally, but I know the problems out there, and we're just inundated with way too much information. And how do you make the best decision for yourself? Because most of us, if not all of us, we don't want to make the wrong decision. But too often we find out too late that it's the wrong decision, especially when it comes to our beauty. And I can't tell you how many times I've seen these amazingly beautiful people totally get their faces ruined because they did something that they shouldn't have done. So rather than promoting a specific product or person, what I want to do is promote a process by which you can navigate the complexity of all your choices out there and how to make the best and smartest decision for yourself. So how do we do that? We do that through role play, because through a role play, rather than the lecture, you get to relate and connect with the person playing that role. And these may be very real situations. They may be personal, or there's something that they've seen someone else do because of their, experience in the fields. But as you relate to these real-time situations, no judgment there, of course, and find a way to figure out how to make the best decision for yourself, as the one person will navigate the one with a problem through a resolution. So how do we do that again? Both are going to role play for about 6 minutes. One's going to present with a problem. The other's going to present with a resolution. And then what we'll do is we'll unpack that. So our total show is about 25 minutes, maybe a little longer, because these guys like to talk a little bit. And so we're going to unpack some stuff on it and give you some insights and action steps that you can take. So I'm really excited to be introducing both Dawn and Henrike. We'll start off with Henrike with her introduction, who she is, where she's at, then with Dawn. Then they're going to share with us, what role they're going to play. And then we're going to go for it and give you, hopefully, the insights that you just needed to make a better decision for yourself. So welcome, Henrike. Who are you?
My name is Henrike Ewan. I am a tenured makeup artist, 30 years plus, and more recently a permanent makeup artist. And mother.
No.
How about that?
And
of
you're
adult children.
And adult children, right?
Adult children.
And you're in Tampa Bay area. Awesome.
Tampa Bay area.
Yeah. So welcome today. We already had one amazing show with you, and you're very humble with your experience and the people that you've impacted over the last 30 years, which has been quite tremendous, because I have to hear everything from Dawn about you. So anyhow, Dawn, who are you?
My name is Dawn, and I have been an esthetician for over 20 years, and then I went into laser and nursing. I own a med spa and surgical center in sunny Orlando, Florida, and my first gig was with you as an esthetician, Dr. Rademaker. So I love the beauty industry, and of course, I'm also a mom, but my little baby is younger, so my baby's a toddler. So I'm a business owner and a mom.
Awesome. Yeah, and I got a lot of gray hairs from that time. Short stint, but many gray hairs. No, just kidding. Amazing experience with you. So what role playing, or what's your role today, Dawn?
So I'm going to be a client that is coming in for permanent eyebrow makeup, and I've seen it on social media, so I'm ready to get it done.
So characterize that person. Are you excited? Are you scared? Are you confused? Or you're confident? Who are you?
I'm a combination of all of that. I'm excited about the prospect of not doing my doing my eyeliner anymore on my eyebrows, but I'm scared because it is still involving needles, and I'm also a little bit nervous.
Okay, great. Henrike, who are you, and how are you showing up today?
I am a permanent makeup artist, and I am going to guide Dawn into style, color, making the right decisions about who she chose to do her permanent makeup, eyebrows, microblading.
Great. Awesome. All right. So you've got 6 minutes. So go for it, Don.
Yes, I'm so excited today. I am a ginger and I want to get my eyebrows done, but being a ginger, I got to find just the right color. And I've seen all these different styles on Instagram. And I also want to make my eyebrows look like one of the models that I'm going to show you a picture of.
All right. So it's interesting that you have, I'm glad that you brought photographs or images to show me so we can start the process there, and I can give you some realistic ideas about color choices. Tattooing used to be for eyebrows used to be a whole lot different. Ink has definitely come a long way in the industry, and a majority of people that I do see have come in and they've had eyebrow tattooing from 20 years ago, and I see now that color choices back then are very, very different to the choices that we have now. So, and especially being a ginger or in the red tones, it's very, very important to choose the right ink color because, and our body chemistry changes with everything. But getting that right color choice is super important for you to go away with the desired color and effect for your eyebrows.
Yes, I've seen some like orange eyebrows or green eyebrows. Was that like the old technique?
A lot of the old techniques, they come in with very either gray or green tones, and it's permanent. And the tattoo ink that they used to use was definitely permanent, and now it's more semi-permanent and a little bit more organic, I would believe. And I try to choose organic companies that provide ink choices of various colors, but also shape and realistic views on or images that you've seen on Instagram or Pinterest or whatever choices you've made. We can look at that and we map everything out and get you to the correct shape. And but these last about 2 to 3 years, and it's really nice to come in and get an annual touch up. If not, every couple of years, it's good to get touch ups.
So I'm losing some of the hair in my eyebrows. I've noticed that as I'm getting in my late 40s. So does that technique, that's the hair stroke technique?
Yes, there are many different techniques, microblading being the hair stroke technique, and that is where each individual hair stroke is put into the skin with a little blade. There are other options, and you can use tattoo guns or machines, as they want to call them. And that is just the same technique, but with a different needle.
So one of the reasons why I came to you is because you've been a makeup artist for a really long time. So you've seen all types of eyebrows doing makeup. You filled in pencil and all that. So does this have the same kind of feel to it? Do you usually do the same shaping with the pencil? Is that what the mapping is? And then you're going over it?
So generally what I do is have clients come in and have their makeup already on, whether they use a pencil or a shadow or a cream, whatever, because that's how they tend to like it. Not everybody is very, makeup, naturally. They can't do it always the best way, but so that way I can at least get an idea of what they do on a daily basis, shape-wise, what kind of products they like to use. But obviously, the end goal is for them not to have to use products anymore. Their brows will be there every day when they wake up. They're waterproof. They can go to the beach. They can, it's one less thing to do in the morning and less products that they need to buy. So it's an investment, a good investment, just like skincare or anything that you do with your skin. It's one more beauty factor that's an investment. But in my opinion, I've had mine done and it was worth every single penny.
Excellent, excellent. And I get Botox. Will this affect my Botox or anything that I'm doing for my face? Should I get that before or wait after? What is your suggestion?
So I suggest, and it's, you can read up on this too, and I'll send you some research, but at least 3 weeks before or 3 weeks after would be a time to think about Botox, probably longer, maybe a month or so. And definitely if you're thinking about getting laser treatments or facials, anything like that, or anything that any products, just stop those about, don't do that anytime soon, within about a month or so. And if you're getting filler, I like you to wait like 3 months, especially if you're doing like lip tattooing or anything like that. It's definitely a 3-month period. So
Got 1 minute left, guys, or less.
So what should I do before the appointment? Because I'm really excited. Should I, watch anything that I'm drinking? What is my pre-care and my post-care like?
okay, so you should definitely avoid caffeine the day of. Alcohol also, it's best to leave 24 hours before you come in. And any blood thinners, that's also important. We do use I use a numbing cream. And so make sure that you have no allergies to anything like that. But just come with, like I said, you can come with makeup and we can clean that off after I see what you look like with the way that you like to have your brows. And then we'll go from there.
So I have a girlfriend who did her brows and one came out completely messed up. Do you ever fix any botched brows? Can I send her your way?
So a couple of different things. I do accept clients that have botched brows or some older brows. It's not the ideal client, but I also have a place that I can send them to get laser removal if necessary ahead of time, and that is usually that's the best route. But yes, I have done many and I've had success. It all depends. Everybody's individual.
Excellent. Thank you so much. I'm so excited.
Well, great
You
job.
will love it.
Yes.
Great job, guys.
Come up here now and do it.
So Dawn, what was that for you?
Oh, that was excellent. Very informative. I'm actually a real client. I really do want her to do some of my touch up because I had done mine years ago.
But what role were you playing? I mean, what was
I was playing like the new client who had no idea what she was getting into, just saw that it was the newest trend or the newest fad and just thought it was just going to be like going to get my nails done. I didn't understand the process and it was great that she explained it all to me.
Awesome. Enrique, what was that for you?
I was the professional of permanent makeup and explaining the process and what the expectations are of a microblading appointment. And that's it.
So let me ask you this question. You guys did a wonderful job in educating. But I'd like to hear from you both because you've got this experience and it's that challenging client. And no judgment against them, but they're just confused. They're uncertain. They got the wrong information. So give us some guidance as to what's going on with those confused individuals and how can they best navigate that part before they make the wrong decision. That make sense?
Yep. I have a lot of older clients in particular, definitely sometimes over 70 or over 80. And a lot of times they come in, I'm going to say 95% of my clients are referrals anyway. So, they've seen somebody or they've had, somebody's already been and come and had their eyebrows done by me. But they're not really quite sure even what microblading is. They just show up and they know the cost and they're willing to do it. They just want the ease of having their brows every day and they don't have to touch them. So, but educating them ahead of time, having a really good investigation again of what they really mean by what do they want? Do they even understand what they want and what it is?
And Don, what are some of the challenges you feel that patients, experience in this process?
So, in brows or even in aesthetics in general, like she just said, they just know they've heard of it and they just want to do it. But as an expert, I have to be willing to say no sometimes too, because sometimes it's not a good fit for that person or they have unrealistic expectations. So they have to have, like I said, ahead of time. I always try to do a touch base phone call with clients ahead of time. Hi, I know you're coming in for a consultation. Just wanted to get a little feedback before they even walk through the door. So that way we've already establishing that relationship and helping them make the right choice, because I don't want to waste their time and I don't want to waste my time if it isn't the best fit for them to get something done. I had a client who was on blood thinners, so she was very limited on what she can and cannot do. And she didn't even understand why she can't do that. So I had to really give her the information and explain the risks involved.
So one of the things that I think is so important, and I know you guys relate to this because I know you, but what's the purpose behind having all this beauty work done? And usually it's about feeling good about yourself. But I'm curious if you ever find, because I have found patients that want to have a certain kind of feeling about life, about themselves, thinking that they're going to achieve that with the procedure that they're going to get, when ultimately their beauty is not going to change anything. And I'll give one specific example is where a patient, was having relationship issues, was wanting to do the surgery, hoping to make, improve that relationship. And I basically say, no, we're not doing that, simply because that's a whole different issue. So does that show up? Are people trying to do these procedures to be someone else that they can never be? And how do you sometimes identify that, and how do you ultimately guide them to make the right decision? And I'll just say this, I'll end up by saying what I learned very early on in my career as a plastic surgeon. I always started off, my only outcome is that you're happy. That's it. And so, how do we get there? Is it always going to be successful? No, because the body has limitations, that's for sure. But that's the direction that, we ultimately want to go, because it is that happiness factor. And we're not always going to be able to achieve that. But what can we do, or what do you guys do to achieve that as much as possible?
So I'll go first. One of the reasons why I still love doing aesthetics is because it gives me the time with the client. Some of the other procedures that I'm doing are a little quicker now, like laser and injections, but aesthetics, you're doing facials, you're doing treatments, body treatments. So you have a good 45 minutes to an hour to get to know that client. And I always tell them, I even have a little sign that says, this is your time. You can sing, you can talk about your dog, you can take a nap, or you can just talk. And a lot of times they talk, and that's usually where I find out. I do ask them what their goal is in the very beginning, but they don't always divulge in that first consult the real core reason why. So yes, that does show up. It shows up with a lot of divorcees. It shows up with a lot of moms. It shows up with, like you said, unrealistic expectations. They see something different in the mirror than what they feel. So, but the entryway to even have a person be open to talking about that is at least have them meet the goals that they're looking for. If I'm there doing a skin type of treatment and I know it's not going to cause any harm, and they understand the expectations, because the key is making them happy, because they have to be happy on the inside. I can't do that. I'm not a magician. That's on their work. So yes, it does show up. But I don't just kind of go, okay, this is going to be more complex. I really do take the time, and I was blessed to have some coaching when I was younger, and it made a huge difference. What got me through the door first was my first plastic surgery. And then from that point forward, I felt better about myself, but then I really started asking, who am I? So yes, it does show up in our particular practice. I do give it some time, and then I do refer them to coaches and different people to help them with their spiritual journey. And I do say no if they have really high expectations that we can't meet.
Yeah, if I remember correctly, you came in for a consult. I found out you're an esthetician and said, I'm going to hire you. Isn't that how it went?
Yes, I believe
Something
so.
like
Yeah.
that.
And I
No,
did
but
have surgery, and I was very happy.
well, I wasn't going to share that. So the key point I think that both of you are saying, and then I'll have Enrique also expand on that, is expectations. And so I think the real failure that I've experienced, hopefully, is simply, didn't quite manage the expectations, or they had expectations that they didn't share. And so that's where I learned very quickly, we've got to be very mindful and careful as to how people understand, exactly what kind of outcomes, and there's never a guarantee. And so, yeah, so, being very mindful and careful, how you make those decisions, but that's also with everything else, right? I mean, it's an investment, as you guys said, in yourself, and that's important. But your role in making that transformation happen is probably much larger than what any of these providers will be doing for you. And so I think that's an important part. And I think at times, or too often, the individuals are not responsible enough in making the right decisions. Enrique, and you know what, here, this is just a real conversation. This is no criticism of anybody. The whole purpose of this podcast is to share the inside voices of what our opinions are. They may not be appropriate for you or not, but that's okay. We're actually having this conversation that needs to be had so that people can recognize, okay, yeah, that's me. I got it. Let me make the shift. And the best times that I get when I'm being coached is those times that I get triggered the most. And it's like, so I got some work to do here. Enrique, your thoughts?
I think I kind of have two different kinds of clients, and the very confident, like Dawn was saying, like the divorced women, and they're looking for that next thing, or I have the ones that are super insecure, and a lot of insecure women, but just guiding them into making the right decisions for them. A lot of these women, like, they're looking for something, but they're not quite sure what it is. So, and like Dawn said, I have somebody in my chair at least an hour, sometimes two. Some of my really close friends are my clients, and they've just become friends. It's like a therapy session, they talk and they talk and they talk, and then they let things out. And it's, I have such great connections with so many of my clients, and I just met them, so but yeah, just guiding them into making the right decisions, because a lot of times they just don't know really what's out there and what the best thing is for them.
So really, I mean, you're providing a beautiful service. First of all, allowing people to get witnessed the way they want to be witnessed, and then witnessing them in their own struggles and being heard. And I think we all want to be heard, because that also helps us navigate the complexity of our lives by just, having a conversation with somebody else. And I think there was a study once, and I'm thinking the psychiatrist might be upset with this statement, but I can't make a reference exactly to where the study was, but they compared people with, mental issues, and they had three groups. They had the regular person, they had the medical person, and then they had the psychiatrist, and I think they're all equally effective. And so it goes to show that, as you guys mentioned earlier, is this connecting with people. And this is one beautiful way. Our outside, connects immediately with others, and we respond that way. And it's a beautiful thing. And so when our outside matches our inside, then that connection is even more aligned, because energetically, we're also transferring that connectivity as well. So we're wrapping it up. Dawn, how do people find you? And last comment.
So just to kind of reiterate what you said, Dr. Rademaker, is our tagline at the spa is we enlighten, we brighten, and we care, because people want to know that you care. And that's the beauty of this personal service, is they know that you care. So they can find us on enlightenmedspa.com. We're in sunny Orlando, and our Instagram link is on there, our Facebook link, our TikTok link is all located there.
Awesome. Thank you. And Enrique, how do people find you? And last comment.
Thank you for having me. And I am on Instagram at Tendrika Beauty and PMU. That's permanent makeup. And I'm actually in Tampa Bay, and I'm on Kennedy Boulevard at On Point Image Studio. And that's where my physical brick and mortar location is.
Excellent. Well, I'm Dr. Bart Rademaker. This is the Doctor's Guide podcast, raw and unfiltered. helping you get the insights that you might be looking for simply by listening in to some role playing that you might be able to relate to connect with, and if it's for yourself or perhaps for somebody else that you care about and want to guide them, just share this podcast with them. Because the truth is that there's so much information out there, so much content. Today we live in a world where we have access to all of the information at our fingertips. The problem is that you don't have enough fingers to reach everything, and some of those touch points may not be appropriate for you. So the podcast is designed to help you with some critical thinking, with some discernment, and a process that might guide you to make better decisions for yourself. So I want to thank both Enrique and Dawn. Thank you so much, and we will be back. Thank you for listening to The Doctor's Guide, an innovative approach to help you navigate the complexities of your health journey with Dr. Bart Rademaker and his expert guests. Tune in to more insights and action steps in our next episode every weekday at 6 p.m. Eastern.